thank you so much for dedicating to deciding to spend this half hour together. And I will try to stay in the right time of the 30 minutes. Whatever you have, a rabbit or a tortoise, a parrot or a bearded dragon, this webinar may still be of interest to you. I can see also that there are a few colleagues, so I don't want to disappoint obviously your expectation. This is obviously the aim of this webinar is try to give obviously like a broad view on literally what could happen when we are looking for our patient. For those who don't know me or haven't followed the previous webinars, let me introduce me briefly. My name is Gianluca, and I am a vet who deal with exotics and zoo animals. I'm particularly passionate about topics such as welfare and husbandry. And I create this series of webinars to try to bring the world of veterinary medicine to a level that is understandable for everyone. We have already covered a few topics, such as first aid, ear disease in rabbits, especially in globe rabbits, and environmental enrichment. Today, we will see together what happened during a clinical visit when you bring one of your animals to the practice. Just to let you know, today has been a quite busy day at the practice, so probably I won't be very ready, but I will try to do my best. In particular, we will focus on the additional tests that we can often need to help us to identify the underlying issues. These can be so-called invasive, such as a blood sample, an ultrasound scan, an X-ray, or a CT scan. And when they can most often require a sedation. We can do also without, but most of the time we have a sedation to calm and don't stress too much our patient. But we also have non-invasive tests for which having a microscope on hand can be equally very, very useful. In fact, we can sample and examine hair, feathers, scale, feces, even urine, to see mainly parasites, but not only. And as we can see here, obviously parasites are exceptional organisms from an evolutionary point of view. They exploit someone else's body to gain advantage, to eat, reproduce, and multiply, and colonize other hosts. Some can be quite simple, others have much more complex cycle. For example, they need more hosts to complete their life cycle. And where can they carry out all these activities? Either outside or inside the body of an animal, humans included. In this way, we can obviously distinguish them into ecto, outside, and endo, inside parasites. As you can see here, obviously, as I said, we are not just looking for parasites. We can see also for bacteria and fungus, understand just looking sometimes the feathers, if the diet of our patient is appropriate or not, and also the behavior, because if we have a destroying behavior that is bring for example, parrots to chewing the feathers, obviously we can recognize these also assessing the feathers. Then we can assess obviously the urine, again for parasites, but also to assess the kidney function, to see if there are any bacteria, if there is a cystitis that is going on, or in some cases, we can also test for hormones, like cortisol, that is the stress hormone, can be tested through the urine, obviously parasites. And then to arrive to the feces, again, here we can identify most of the endoparasites, so the parasites that are living mainly in the gastrointestinal tract, bacteria, virus, and also, again, diet, because analyzing the feces, we can also see what the animal ate and then understand if he's eating properly or not. But let's go in order. Let's say that your rabbits start to develop unusual scabs on their ears, or abundant dandruff on the back, or even start to scratch themselves so hard to hurt themselves. So you have made an appointment with your vet, who once has started the clinical examination and put together all the information you will provide them. For example, since when the scabs appeared, how often your rabbits scratch themselves, etc. And then he may decide to start collateral investigation, for example, taking a small hair sample to have a look more closely at the fur. And once the vet had put the sample on a slide and turn on the microscope, the journey begins. So we can start obviously to assess our sample. And this is what you could find in front of your eyes if you want to try to have a look at the microscope. A party directly under the magnifying glass of the microscope. And as you can see, everything starts to move. I know that now everyone starts to scratch is a normal reaction, okay, perfectly understandable, but this is literally what we can see. And sometimes I know in the list that also there are some of my my old clients, and I always like to show them during the consult also what I was looking at under the microscope, because it could be also helpful for yourself, see what we see then, and to better understand why the rabbit is scratching, or to justify the treatment that we are going to perform. Okay, and obviously mites are the most common one. Here we can see a collection of different mites with specific signs and lesion. We can go in order, literally starting from the Psoroptes cuniculi, that is obviously these are all specific of rabbits. And we can see the Psoroptes cuniculi, that is the one that is mainly localized in the ears, and it can cause these typical lesion and scabs in the ears. Then we have the Cheilitellus parasitovorax, that is characterized by the white dandruff on the back, that is so-called also walking dandruff. Then we have the Leporacarus kippus, that is mainly localized on the fur, not on the skin, so it's a little bit more tricky to discover. And then we have the Sarcoptes scabiei. Sarcoptes scabiei, and that is the mange in humans. This one is probably one of the most painful one, because as you can see here, the lesions are quite evident, big lesions, scabs, and also the mites can literally dig under the skin. And this is the reason why also for us could be quite distressful. So think for your rabbits that have this very strong, is itching everywhere, and is trying obviously to scratch and try to find some relief. So you have also to remember that Sarcoptes scabiei and Cheilitellus parasitovorax are zoonosis, means that it can be transmitted to us. And sometimes happen that vets can do the diagnosis. Also seeing the owner means that, oh, if the owner is scratching a lot, there are some obviously like little teeny tiny red lesion on the skin. This could be a sign. Obviously, we cannot do anything for you. You have to refer to your GP, just like, oh, my vet found on my rabbit this, and this, and they will be able to help you. But also sometimes when we cannot find the mites, obviously the suspicion is still quite strong with this type of lesion on you or on the rabbit. Then we have the fleas. Rabbits can have fleas, are not common as mites, and most of the time they can be transmitted to the rabbits by dogs, cats, or for example, if the rabbit is living outside. Ticks are among all these parasites probably the least frequent in rabbits, but are not unlikely, say, for example, if a rabbit is living outside. Here I want to bring you, this is a case of few years ago, where these rabbits start to develop this like a horn on the nose, and all the scabs are along the margin of the ear pavilion and around the toes. And once we took a sample and checked under the microscope, obviously it was definitely a mites infestation. So we start obviously the treatment. Very often, and especially with mites, the treatment could be quite tricky. This means that especially like in this case, we have to treat the rabbits for a total of 4 doses, 7 days apart, one to each other. So this means that you cannot expect a miracle from a single administration. And antiparasitic must always be used under the guidance of your vet. So the advice is always, if you see something like this, don't start a treatment, because it could be also any other underlying condition that's possibly predispose these mites to start building up. Right? So don't attempt to do any DIY treatment. And a very important thing to underline is that these parasites, mites, fleas, and ticks, can represent a source of contagion for two viral diseases that affect our rabbits: hemorrhagic disease and myxomatosis. To clarify, so as not to open up Pandora's box, and because it is not the topic of this webinar, today I'm not going into any detail regarding vaccination. The only thing I want to say is to always vaccinate your rabbits every 6 months or once a year, depending on the protocol, whether it lives indoor or outdoor. These represent the most effective preventative treatment. In the rabbits that obviously live outside or has access to an outside pen or runner and in possible contact with wildlife animals, vaccination become obviously life-saving, also associated with that spot-on treatment. So always combine the two. And also, you also do a lot for them, which periodic check by yourself at home means that every time, so once a week or every time the rabbit has spent some time outside, you can check between the fur and see if you can identify any of the parasites or the signs that we mentioned earlier. Then we have guinea pigs. Also, guinea pigs can have mites or lice. The Trichsacharus caveat should be easier for me because it's Latin, but it's not. I can guarantee that it's difficult for me too. So the Trichsacharus caveat is another one that can cause a lot of discomfort because it can be very itchy. And this was a guinea pig that was started to scratch themselves a lot until open literally the skin. So we shouldn't never wait too long before bring them for a check. Then we have the, let me see, this one, the Chirodiscoides caveat. Again, itchy time, but I found them very fascinating. But these are mites that usually are just localized on the fur, so are not causing any damage on the skin. So again, they could be a little bit more tricky to find out. At least we are not taking some of the fur and check under the microscope. And the Biliricola porcelli is a lice. And what I found very interesting on this one is how they can move the eyes. I know it's mad, but again, you need to find something interesting also what you're going to do every day. And also this one is mainly on fur, so there are no major signs that you can obviously see or identify to see what is going on. Then we have the last one that I want to mention, because also these one are quite common, are the ectoparasites of ferrets. This one is the Otodectes cynotis, and this is a little bit creepy, more than the others probably. And this is mainly localized in the ears. And ferrets, usually ferrets that's living at least in a pair, say they are not so predisposed because these mites are localized in the ears and they can grow very well in the wax of the that is present in the ear. So ferrets that cleaning them each other usually can obviously keep the ears clean. So this risk is reduced. It's not impossible, obviously, but it's reduced quite a lot. So it means if you have a ferret that is living alone, in brackets, also if you shouldn't, but say for any reason you still have your ferrets that's hopefully living alone, you have to check the ears and just to be sure that are clean. Don't try or don't attempt to clean by yourself with a cotton bud or any solution without, also in this case, the guidance of a vet. Because the ear canal of a ferret is very narrow, so the risk is if you're going, for example, too deep or you are too rough, the ear canal can start to bleed, or you can also cause any major damage at the level of the ears. But again, if you see a ferret with a lot of wax and it starts to scratch a lot of the ears, possibly this is the reason. And next one. We saw the creepy one. Then just a glance on reptiles and birds. The chewing lice are mostly common in chicken or farm, like ducks, farm animals, farm birds, and are called so-called chewing lice because what they're doing is literally chewing the feathers. So the recognizable signs when these are present is the damage on the feathers. Usually they're not very itching, so they can just building up in number. And if you have chickens, you can just try to move gently and have a look at the base of the wings, the base of the feathers, where usually they are localized. Then we have the Nemidocoptes, another nice name. And this one is the mice that is most frequently found in budgies. So as you can see, the lesion that they can cause, they can obviously quite invasive, quite destructive, and cause a lot of discomfort. Sometimes if left for too much time, obviously they can cause damage on the beak. And here, the picture that I literally zoom in and magnify, you can see literally the tiny lesion that the mice can do, obviously literally digging in the skin. Yes, so we can back on your question at the end, so I can click there and save, and we can go back without no problems at the end. Then we have in reptiles, usually mites are more frequently seen in snakes and lizards, a little bit less in tortoise. They are quite small. In snakes, there are less chances to hide themselves, but usually they can find a little bit of space under the scale. In lizards, as in this case, we can see that they can be localized at the level of the rim of the mouth. And as you can see, obviously, what I've done here was taking a little bit, a small sample, just to check what I was doing, because they were very, very tiny. So I always like to double check under the microscope what I'm saying. Then, so finish about speaking about ectoparasites, we can obviously dedicate a little bit of the time also to the endoparasites. And usually what we can say about rabbits is that, obviously, let me see your feces and I will tell you how you are. Means that usually what we can tell a lot, just have a look to the feces, means that if they are already rounded, same size, no problems, or means that the rabbit is pooping well. And obviously we don't have a lot of concern. Differently, if we start to see quite a watery feces or more runny, like proper diarrhea, or we don't have to confuse a cecotroph for something pathological. So the one here, this tiny feces all attached all together, this is the cecotroph, is normal. You shouldn't be able to see it because the rabbits have to eat it straight away. So you also have to identify why your rabbit is not eating the cecotroph, but again, is not the right webinar to speak about that. And or we can see this feces like a long chain, because the rabbit is grooming himself, or if living together, obviously when they are grooming each other, they can swallow a lot of fur, and the feces can obviously resemble like a chain, quite long chain. So what we can see on the feces is not obviously just these. The feces at this point are telling me a lot, but from the feces I can also see if there are any parasites. And I don't know if you have any chance to see the Passalurus ambiguus on the feces of your rabbits. They are not so common to be seen, but they're not so rare. Usually they're not causing any problems. They are more problematic in young rabbits respect adults, and they appear to be quite small. And differently, what we can think, like in a dog or cat, when there are parasites, also the dog can show like diarrhea or feces that they don't look normal. In rabbits, the feces can be also completely normal. Like in this case, you see, normal fecal pellet, perfectly rounded, nice sides, but with the worm that is coming out. Also in this case, for example, also in this case, it's very, very important to have the feces of your rabbit checked at least once a year. For example, when you're going for the vaccination or for the routine health check every 6 months. Also, if you don't see any parasites, because sometimes they can be there without causing any problem. And I can say the same for the coccidium. So coccidium, they can obviously be life-threatening in young rabbits because they can cause a lot of problems and damage in the gastrointestinal tract. But usually also adult rabbits can have them without showing any signs. And a fecal test in this case, again, could be very, very useful to detect if they're present or not. In this picture, where is the intruder? Because as you can see in this picture, what we can see is a lot of like something that resembles parasites, all these like oval structure, they look parasites, but the only parasite is the rounded one in the center. And let me see what I can. I probably, yeah, is in the center here. Probably, I think that you can see the arrow, but it's literally the one in the middle. All the others are yeast that are part of the normal intestinal flora of the rabbit. So nothing to be concerned, and it's something that you should always see every time. Endoparasite in reptiles. Obviously, also reptiles can have parasites. They can have many, but sometimes they could be completely normal, like the Nyctoterus, the one that is swimming here. I mean, swimming in feces is probably not the best environment when you can have a swim, but these parasites are completely normal. Sometimes, like in the video on the bottom left, they can start to building up in number, and this could be indicative of a dysmicrobism. So when you have problems at the level of a disbalance at the level of the intestine. But again, these parasites usually are perfectly innocuous. They're not causing any problems, but they could be sign of something else. Then we have nematodes, in the specific one, odot of oxyurids. And in some reptiles, as we will see in the next few slides, the oxyurid in some of the reptiles are normal, again, when they are not too high in number. So when the burden is not too high, they could be considered completely normal. Usually when we are sending, if you are not performing the fecal test by yourself in the practice and we are sending to the lab also is sending us back a result with the number, the count of how many parasites or eggs they found in the fecal sample. And there is a range, or say a limit, below that they are normal. Over that, obviously, we have to treat, but below that, they are considered normal. Sometimes what we can have is also have few parasites present at the same times. Like in this case, you can see the bigger one is the ascarid, an egg. Then we have the rounded one in the middle, and bottom one there are coccidia. And I think that you can see there are teeny tiny ghosts, literally tiny, very tiny parasites that are floating around, and these are flagellates. And these highlight how important it is to check the feces, because you have to consider that these three different parasites, they have respectively 3 different treatments. Means that all we are treating with a blind treatment, all the reptiles with all the meds all at the same times, but is not healthy, is not safe, and is not right for the patient. Or with a fecal test, we can identify exactly which parasites are present, and then this allows us to administer the right and the more specific treatment is needed. In this case, potentially we have to treat all of them, or starting with the most dangerous one that I consider to be the Trichomonas, and then see if this can allow to literally rebuild the normal flora. And if not, we have to recheck in 10 days, 2 weeks the feces, see again. Okay, we say we had rid of the flagellates, but we have still the others. So then at that point, we can consider to treat also the others. Is not probably completely right or, again, healthy for the patient treat all at the same times, because we can literally give too many drugs at the same times. And so it's better. The approach that I prefer is to treat every time for the specific one. Then we have also parasites that are a plague, if you want, in reptiles, that is the Cryptosporidium. This is a parasite that usually we are not able to see under the microscope by yourself. So we have to send to the lab, and the lab have to perform specific tests to identify the parasite. Unfortunately, for the Cryptosporidium, there aren't still any effective treatment. So, but it could be very helpful to know if, especially if you have a lot of reptiles, if one of them is affected by this parasite, because you can separate from the others, avoiding that also the others can start to develop the same problem. And because it's a parasite that is quite detrimental, sometimes we have also to take the difficult decision to consider if the quality of life is affected, also to take a different decision. But obviously, this is always based on the result of the clinical examination. Okay. But all the parasites are bad parasites? Not all of them. As I said, there are some parasites that could be good parasites, and especially in tortoise. Means that if you have small quantities of these parasites, especially oxyurid and ascarids, are present, this can be useful ally in the digestion of the food. So think a tortoise that's eating a lot of grass or very thick, fibrous grass or weeds, etc. So they are quite difficult to digest. So these parasites, in a sort of way, they can help to obviously move the food content, the intestine content, and help to digest. And there are several studies that show that treating completely, so rid of all these parasites from tortoise, can make them growing slower than they should. So a small amount is needed. Is why it's always better to don't deworm a tortoise just because, oh, I read that I have to deworm a tortoise. No, you have to always perform a fecal test first. And then if the amount of parasites is lower than recommended limit, we don't have to do anything else. Obviously, the problems, on the other hand, begin when this number is too high. And the number can increase, for example, when the husbandry is not optimal. This can cause a deterioration on the general condition, which inevitably also affect what happens in the gastrointestinal tract. Say that the tortoise is not kept at the right temperature, or the diet is not the right one, means that all these little things can allow the parasite to grow in number. Then we will have an unwanted increase of these parasites, which at this point can start to cause problems. And as you can see on this sample, you can see that these tiny worms are, you can see at the naked eye, also if they are still quite small, but in this case, the burden was, the number of these parasites was too high. Usually just few eggs are not a problem, but also this depends on the experience of the vets. But when they start to be like too many, both oodles in the feces or eggs in the sample, like the bigger picture where you can see all the oval shapes that you can see are all eggs. In this case, obviously the treatment is needed. And to combat, obviously to fight parasites, we can generally use natural or synthetic active ingredients. The same antiparasitic is not safe in all the species. For example, think about the fipronil in rabbits that can cause neurological problem, even obviously to kill the rabbits, because it's obviously highly toxic for rabbits, or the ivermectin in tortoise and turtles. So never use this type of antiparasitic on these species. Just to clarify, obviously phytotherapy and homeopathy are two different things. Okay, the first use natural principle obtained from plants with a scientific validity. So we know it's also human beings. So as human, we use phytotherapy to treat some issues, some problems. Okay. But we cannot say the same for the second one, which along with other homemade remedies have not scientific basis, making them not suitable for all the situation. Means if you think to the mites, the rabbits that has been affected with a very big lesion, probably I will rely on something that is scientific proof and is more effective. Of course, we should always start from the assumption of using as few medication as possible. Their abuse could lead to resistance. In fact, like antibiotics, we are also starting to see an increasing resistance to antiparasitic. This means that at some point, they won't longer be effective. So we are using them, but they won't fix the problem. Furthermore, the reckless use of these molecules can irreparably damage also the wildlife and natural ecosystem. Here, I report one article that I found a few weeks ago when I was obviously preparing this webinar, and obviously it's mainly for dogs and cats, but we cannot underestimate the fact that also, for example, rabbits that's living in the garden can have the same can have the same issue. And so if the synthetic molecules, they could be so dangerous, why we don't use just the phytotherapy? I mean, because for many of them, there are very limited research existing on their effectiveness. Some herbal detox programs last like 2 weeks on, 2 weeks off, while others may last up to a month. In the past, I used several times neem oil that is very effective, but is more effective like a preventative treatment, not a proper treatment to fight mites or other external parasites. And usually my approach to the problem is a little bit different. So depending on the situation and the severity of the problem, but I try to understand first if the husbandry is appropriate, if there are any changes that we can make, for example, in the cleaning of the cage, of the viv, so in the hygiene of the enclosure. If the diet is appropriate, because also the diets, especially for the internal parasites, can have a great effect, because think obviously to a diet that is very high in fiber. This and is complete and balanced, means that also the intestine is healthier, and also this can help a good motility. Gastrointestinal motility means the motion of the intestine, and this can reduce obviously that parasite can stay there and start to multiply and damage the wall of the intestine. But say that we can still potentially need some help. Think about mites, or if we have a too high number of parasites also in the gastrointestinal tract. So we can still rely on the antiparasitic, but then we have also to make these few changes to allow that the problem is not relapsing anymore, or at least make these unlikely to happen again. So, message of the evening is obviously don't underestimate the risk of parasites. So if you see your rabbit that is scratching, or your snake with teeny tiny dots walking around, or again, guinea pigs or parrots with very damaged feathers, or the chicken, again, that is obviously scratching or start to look a little bit with the rough feathers, don't hesitate to ask help to your vet, and obviously, in case book an appointment, to have all these tests to be performed. Again, are not invasive, so they are very minimally stressful for the patient and can give us a lot of information and help. Take Facebook as a pinch of salt, because many times I saw in many specific, obviously the pluri-specific species, that giving some advice, or I use this, I use that. But again, every time the treatment should be tailored and on the single patient, okay? Because there are probably other problems underlying, so it's always better to have a proper check of them and avoid DIY treatments, because as we saw, not all the antiparasitic are safe, so we must be very, very careful. And this can be prevented, for example, with periodical vet health check. As I said, you can do also at home a lot for them, in the sense that obviously you can check the fur, see if you can see anything that is moving, but because a lot of the parrots are so tiny that you cannot, again, a check every 6 months or a year, once a year, are still strongly advised. And at the same time, you can also do the fecal analysis, the stool analysis every 6 or 12 months, more often if it's needed. Speaking about tortoise, what I usually, for tortoise that are required to be hibernated, what I suggest is usually to do the check before and after the hibernation or brumation, because these can allow before the brumation to be sure that there are, to minimize the risk during the brumation itself, and after the brumation to see if the tortoise is ready to obviously start the new season stronger and healthier as possible.